Democrats, don't let Fox get you down. In fact, most of the arguments against single payer are easily debunked bullshit. Number one, is single payer too expensive?
The question in terms of giving all this stuff away, free health care, free education, how do you pay for it?
I heard you say you wanted single payer. What's your idea on how to pay for it?
Single payer health care only works with a printing press. Unlimited dollars. Just keep printing the money.
I said a printing press. Is this thing on? Test. You know how I know this is full of shit? Because I have fully 0 clips to show you of Lindsey Graham stressing out about how to pay for that fucking Space Force. Fox can yell at us that single-payer healthcare is too expensive all they want, but it just doesn't make sense. The U.S. currently spends nearly $3.5 trillion every year on healthcare. The average American family spends almost 3 times as much on healthcare, including premiums, out-of-pocket costs, co-pays, deductibles, and employer contributions, as a Canadian family pays in healthcare taxes. Plus, Canadians don't live in fear that if they develop a serious health problem, they'll go bankrupt and have their moose repossessed. The American system wastes more money than Nicolas Cage at a store that only sells wigs and maps. The U.S. spends twice as much on healthcare as other wealthy countries, but has the lowest life expectancy and highest infant mortality rates. And while that does get us one step closer to becoming a hot teen nation, one nation, all teens, it's a pretty shitty deal. A single-payer system would give the government better bargaining power and reduce administrative costs, which, if every other first world country is anything to go by, would save us money. Or, we could just keep paying $15 for a single Tylenol in the hospital, because that's the American way. Besides, Americans already have a socialized healthcare system they love. It's called GoFundMe. 1 in 3 GoFundMe campaigns are for healthcare. The other 2 are legal funds for the world's biggest idiot and a web series that, let's be real, should not be happening. Shout out to all my fans at WikiFeet. So really, medical bills are all GoFundMe is good for. To sum up, between taxes, crappy private insurance, out-of-pocket costs, and donations to strangers, we are paying way too much for healthcare. And if you calculate the costs like that, single-payer healthcare might actually be cheaper. Okay, next argument, it will decrease innovation.
Single-payer systems don't innovate.
Yeah, and the problem with socialized medicine is that, yes, everybody gets coverage, but everybody gets a pretty poor level of coverage, and you don't get the kind of innovation that you need.
These rogue donkeys want to turf any private insurance for some single-payer scam, which, of course, invites not only corruption and price fixing, it naturally brings innovation to a grinding halt.
Okay, first of all, Kennedy, rogue donkeys, that is actually a much better slogan for Democrats.
There will be almost no incentive to come up with new drugs, procedures, and treatments to make people live longer and better.
Yes, the United States is a leading medical innovator. We even have the world's most advanced selection of fake medicines. But those pharmaceutical companies that make all those great innovations here charge Americans more for the same drugs, sometimes as much as 2 to 5 times more than what they charge in Europe, which means we're subsidizing dirty European socialist healthcare anyway. Thanks a lot, Big Pharma. You've given our annoying trust fund friends another reason to tell us why Europe is just like better. Besides, a lot of Americans are already on a single-payer system. It's called Medicare, and it drives plenty of innovation if the billions of catheter commercials I've seen are any indication. And not for nothing, babe, but you know who does a lot of great medical innovation on non-profitable diseases? Colleges and universities, and I don't see conservatives fighting to support those. Okay, next point. It will increase wait times.
We saw in Canada what happens with single payers.
Somebody having to wait a number of months for something that he or she needs.
The average waiting time, 20 weeks waiting time.
I don't know anyone in Canada that likes this. I don't. I've got Canadian friends, and they don't like it.
Oh, really? Is that the same Canadian friend you said you were taking to prom but never showed up? Look, I won't lie. The wait for an elective surgery there can suck, but critics cherry-pick hip replacements in Canada because those have particularly long wait times. Wait times vary across and within single-payer systems, but there isn't a single average Canadian who would fucking trade healthcare with Americans. By the way, Single Average Canadian is the hit sitcom I've starred in on CTV for 15 years. That Canadian who waited 6 months to get a hip replacement because he had socialized healthcare in America without healthcare, he'd just be waiting forever because he would never get the surgery. Now that is long wait times. And in Canada, after your free surgery, you get a complimentary bag of milk. If we want shorter wait times, let's build an American system with shorter wait times. We are America. We have invisible planes and The Rock. Shame on Fox News for thinking America can't do better than Canada. Look, Democrats, I know you're scared, but give the people what they want. It's time you stopped being Charlie Brown missing the football and finally just fucking dunk on Lucy instead. We'll be right back.